Hello, I'm Joseph Duffy, I'm the CEO of Jigsaw. I'm going to talk to you today about youth mental health. What does the future look like? Why is youth mental health a concern? Some of you, or many of you, may know that the onset of mental illness peaks around adolescence. We know that about 50% of mental disorders develop before the age of 15 years and 75% by the age of 25. So being young and the idea being young and experiencing a diagnosis or difficulties around mental health is something that happens to a significant number of young people. When we think about the population of Ireland, we think about young people. The CSO have done some projections based on a 35-year timeline. So they've created 6 different scenarios, and their assumptions would suggest that the population of Ireland is going to significantly increase over the next 35 years. So we know the combination of what I was saying there about being young and the combination of a growing population are leading to, I suppose, 2 factors to suggest to us that we need to think more about young people and their mental health. But adding to that, thinking about this in an Irish context, this is some evidence from work that Jigsaw did with UCD around the My World survey. So in 2012, we conducted the largest ever survey of young people's mental health using a range of psychometric measures. And this is data comparing 2012 with 2019. So between 70 and 60% of young people were experiencing normal levels, in this case of depression, in 2012 and 2019. What we can see as the figures look, and these are repeated again for anxiety and for other levels of mental health concerns, that the number experiencing mild levels of depression went down, thus experiencing moderate, severe, and very severe increased. So what is all that telling us? It's telling us that mental health, and particularly youth mental health, is an area we need to become concerned about and involved in. So what's been the response? Over the past 15 years, there's been significant response worldwide, and particularly within the English-speaking world, focusing on services that are dedicated to young people. Jigsaw is one such service in Ireland, and I'll talk a bit about that. In Australia, we have Headspace. In Australia, we also have Origin, who focus on particularly on young people who might need support around early development of psychosis, focus on policy and on research, and Foundry, which is based in British Columbia and Canada. All of these organizations are working together, but they're also working very much focused on supporting young people and supporting those young people within communities. What are the key characteristics of youth mental health services? Over the past number of years, we've been, I suppose, put together a lot of knowledge, particularly based on an international cooperation from the International Association for Youth Mental Health, which focuses on these 7 factors which impact or really strengthen youth mental health services in the community. The first is having a basis in primary care. That's really important in terms of the entry level or the first level of formalized mental health support. That youth mental health services need to be at that level. Most of the mental health services are focused on a prevention, early intervention model. This care needs to be integrated in some of the services, particularly in Australia. They're connected in with employment services and with education services. In Ireland, it's very much connected in within the primary care and the health network. All those services need to have a youth-centered philosophy, so an understanding that a young person are at the center of the work that we all do. Accessibility is not just the physical accessibility, it's about how referrals are made, how you can come in contact with the service. Can you do that virtually? Can you do that in person? Do you need a referral letter? And how accessible are they, or where are they based within a community? The facilities themselves need to be very youth friendly, so they're not based in the traditional mental health settings, which might have been in a large psychiatric hospital. They're very much embedded and part of the community and connected to the community, not just to, mental health services, but to connect it to all elements of the community. Very strongly, what's behind a lot of these services and the philosophy and the way of working is very much an evidence-based care model, which really has developed that evidence base over the last 15 years. Particularly, I suppose, turning and focusing on Jigsaw in Ireland. Jigsaw is Ireland's leading youth mental health charity. With the support of the HSE and Sláinte Care and fundraising, we provide a range of free primary care mental health services and supports to young people and indeed to their parents and families within community. Primarily, we're probably best known in terms of providing free one-to-one therapeutic supports across 12 centres across the country. We also provide community-based programs, which very much are focusing on strengthening and supporting communities to empower young people and those around them to really promote a preventative model for youth mental health. These are focused on working with young people where they live, learn, work, and play. We have significant pioneering research, some of it in the My World survey that I mentioned, and then robust evaluation in terms of the evidence that we have and how we evaluate the services and everything that we deliver. We've increasingly providing e-mental health supports online through jigsaw.ie, and we've rolled out a comprehensive secondary schools program called One Good School, aimed at supporting the mental health and well-being of young people by developing the shared responsibility for mental health across a whole school community. This is a map which gives you a sense of the services around Ireland. We have 12, as I mentioned already, open and seeing young people. We have 2 in Wicklow and 1 in Tipperary. Last year, we have seen about over 6,500 young people providing over 30,000 individual sessions. We would have seen support nearly 40,000 people since we first opened 14 years ago. But obviously, that's been cumulative, and much of that has been supported, and many of those young people have been supported in the last 15 years. Sorry, in the last 5 years. What impact did COVID-19 have on Jigsaw? That had a significant impact. In March of this year, most of our services were delivered on a face-to-face basis in a setting like this in Jigsaw Dublin City. We had small number of supports rather, online. We were piloting a group chat program, but we had larger plans supported by Sláinte Care to develop that further. You can see on the other side of the screen then what's happened now in November 2020. A significant number of our services are developed or provided through different modes. About half is face-to-face, about 30% on video, about 17% on phone. We've also developed a significant live chat, both individual and group offerings that will be 5 days a week, and also a number of evenings. The individual and the group chat is an anonymous once-off, one-session support for young people. We've also developed text and email support and developed a national free phone number and developed a significant number of webinars and seminars for parents, for teachers, and for young people. The reality is that through COVID, we have moved and pivoted our services to providing all of those supports, and many of them online or in a mode that's much more accessible to young people. We won't ever go back to having everything 100% face-to-face, and what we're continuing to do is continue to operate even through level 5 and having our face-to-face services open. Looking at some of that data then, between March and July this year, here's an example of some of the presenting issues that young people came to us with. Between January and the 12th of March, before we suspended the face-to-face services, anxiety, low mood, and sleep and stress were particular presenting issues for young people. For the period from March to July, really, as was the period of the main lockdown before restrictions started to ease, you can see the other presenting issues again: anxiety, low mood, sleep changes. This time, family problems featured more, which isn't surprising within it. Looking at the key themes and feedback from young people, and some of these factors here wouldn't be that different from the general presentations that we see in Jigsaw. Anxiety, low mood, stress, and family problems certainly are common features of referrals to Jigsaw. Conflict between a young person, parent, and guardian is also there. What was a key feature and notable through COVID-19 was isolation from social and community settings, and also the social supports and peer networks for young people. About a third of young people would have said their mental health was impacted by COVID-19 and would have sought support from Jigsaw, but the remainder had pre-existing mental health concerns that maybe were exacerbated or increased by COVID-19, but certainly it wasn't the causal factor in those. I think it's important to note when we think about the impact on mental health and thinking about the impact of COVID-19 on mental health. We see in Jigsaw the demand has increased and has increased over the last 3 years, and it's that we wouldn't put that down just to COVID-19. There's a significant increase in the number of referrals each September and October, and that's reflected in the figures here for this year. But you can see year on year, there's about 25% increase each year. Those numbers are increasing and steadily growing. That's not a bad thing in terms of young people are continuing to reach out and connect with mental health services. So what does the future hold? We know demand is increasing. Stigma hopefully is reducing, so young people are more aware of the need for support. They're getting that support at an earlier age. One of the key things that is needed is about better integration across the whole mental health system. Jigsaw would see itself as at the prevention and early intervention side of a system of care. There needs to be much more focus on this prevention and on mental health promotion, on early intervention, but also on the use of technology, either through e-health, the phone video elements of that, or live online chat and support groups and direct supports. We also know that this area and the evidence base for it is growing and increasing, and there needs to be, I suppose, better focus on that. One of the things I wanted to draw some attention to, and given that this is a research conference, the International Association for Youth Mental Health set out some research priorities this year. There's 8 of them listed there. I want to focus particularly on 2 of them. What they're focusing on, and particularly their support from the Wellcome Trust, looking at treatment and novel interventions, particularly focused on youth mental health, and looking at are there particular modalities or particular ways that we haven't tried or scaled up yet that would really work to support young people's mental health. And what is the role of new technologies in mental health, not just online or phone or video, augmented care? Is there other ways that we can work and support young people's mental health? And how do we look to blend those technologies in with traditional mental health supports, be they psychotherapy or other mental health supports together? What I wanted to do is to leave you with 2 quotes here. Jigsaw always asks our young people who attend our services and their parents, if they can, to give us their view on what the experience was like, both good, bad, and indifferent. And here's 2 quotes that I wanted to draw your attention to. I'll let you just read those there for a second. What we can see in those messages is that a young person is very much reflecting that they didn't think they would be able to talk, but they found the benefit of coming and speaking within a clinician, in this case in Jigsaw and Galway, was really beneficial. The idea that they would recommend anyone to go to Jigsaw as it helps in any way possible is really positive, because that's what we want. We want young people to be able to influence their peers, to talk openly and positively about their experience and about mental health, and if appropriate for them, to encourage other people to avail of services. I think the last one for me was indicative of how we're all working at the moment, and how this session in particular was over video for a young person, but that didn't seem to impact and certainly didn't impact negatively, and the young person was able to get the benefit from it, but that the parent is reflecting on the impact of the young person getting support, what positive impact and a great positive impact that has had on the whole family. So I think there are 2 nice quotes to end on. What I want to say is thank you very much for listening. Thank you for taking the time to think about the work that we're doing, and looking forward to having further conversations with you at some point. My email is there. Thank you very much.